Amira from NASAM Ampang. This video is about caring for a stroke survivor in hospital and preparing for discharge. Here I am sharing with you some situations that can arise when your loved one is in the hospital or about to be discharged. The situations will differ. If in doubt, always seek for medical and professional advice. The first situation is when your loved one has been admitted into a hospital. One of the first things to be done by the family is to meet the doctor in charge. Find out what caused the stroke. For example, was it caused by high cholesterol, diabetes, high blood pressure, smoking, or some other risk factors? Only when the risk factor is known can the recovery be better managed. Then you need to ensure there is monitoring and follow-up to identify and rule out other causes of stroke, such as cardiac problem, issues with the rhythm of the heart, heartbeat, and other issues that affecting the heart valves. If your loved one had a hemorrhagic stroke, find out if there are any other vessels that may leak or burst. Remember to find out how to manage the risk factors and the causes of the stroke to prevent another stroke. Okay, now this is important. As a family member or caregiver, please be advised not to treat the strokee as a child or invalid. Make him or her a part of the decision-making process if possible. You can do things with the strokee, but where possible, do not do it for them. Always remind them that the other hand and leg still works. For those who wondering, when does rehabilitation begin? Okay, for rehab to begin, the strokee must be declared medically fit by a doctor. Be patient and always follow medical advice. All that I have mentioned so far involve the strokee early days in hospital. Now, what happens when it is time for discharge? What do you as a family member need to do? First, preparation for stroke survivors' discharge. Ensure there is a discharge summary. This is important as it will help a clinician and rehab team to better manage recovery after discharge. Make sure there are appointments for medical follow-up and rehabilitation. Keep up with the appointments. Recovery is ongoing and can be long-term, so be diligent. Before discharge, the family has to decide where the strokee is going, whether back home or to a nursing care or rehab facility. Let me share some points you may want to consider before you decide the next move. First, to look at the condition of the stroke survivor. Is there a trachea, a breathing hole at throat? This requires full-time nursing care, so it is either a 24/7 professional nurse in the residence or a nursing home with 24/7 nursing care. Then their mobility. Can the strokee move around? Will there be someone with him or her? If no one at home, then you have to consider a nursing home or a daycare arrangement. If the strokee is returning to the family home, please consider these issues. What is the home environment like? What is the access into the house? Are there steps? Are the doorways able to allow entry by wheelchair? Are there ledges? If the home requires modification such as ramp, handrails, it is best that you consult an occupational therapist. This can be done while the strokee is in hospital. For home use, you may want to consider a mobile commode with wheels and brakes. If the strokee cannot come home and you need to look at nursing homes, here are some pointers. Check if the home has a professional nurse in attendance. The nurse must be an SRN, as only registered nurses can dispense medication and manage trachea cases. If the strokee is mobile and cognitively alert and able to manage his or her own medication, then an enrolled or a diploma nurse is fine. Also find out if there is doctor in attendance. Nursing homes must have this in place. For recovery, the strokee will need rehab, so find out if there is a visiting therapist. If none, ask the home if it's fine for your own therapist to go to the home and attend the strokee. Go and inspect the home to see how well it is run and if it suits your budget. Also look at hygiene and cleanliness. Are the residents happy? Is it crowded? What is the staff to patient ratio like? About 1 to 4 or 1 to 6 is nice. What is the food like? What activities do they have? If the strokee is expected to cause long-term disability, get an OKU card. For NASAM members, please seek help at the admin office. If the strokee is young and was employed before the stroke, the family should check if he or she is eligible for help from SOSO. That's it. This is just a brief sharing to help you as your journey with your loved one. You can also check our website nasam.org. Go to the section that says Useful Info. If there is anything you need urgent help with, please call us at our helpline 018-222-1878.